Welcome to a new edition of the Famous Interviews with Joe Dimino. On this episode, we talk with surgeon, medical professional, and children's book author Rachel Wellner. She is the author of the Doctoroo series of children's books. She is a board-certified general surgeon, a fellow of the American College of Surgeons, and Society of Surgical Oncology-trained breast cancer oncology surgeon. She has been a featured guest and an expert on several local and national news networks. She is a very energetic person with a lot of stories and great insights. Enjoy this interview.
Thank you for taking a minute out today. I appreciate it.
Oh, my pleasure. Thank you.
You bet. So let's get in, before we get into your life as a professional and an author, I want to know, how did you survive that 2-year pandemic window? I know we're not necessarily at, but how did you survive it, and how did it change you subsequently?
Well, I had just moved to Los Angeles, and it was a little bit difficult for me because I was looking for, to socialize and increase my network, and I just couldn't. Right? It was just a time where nobody really could. So, the good thing is I had taken clinical time off to work on a biotech company that I started. So I didn't need to be in the hospital. So, isolation was just part of my work anyway. So I wouldn't say that it affected me personally as much as it might have affected others in that way. But boy, did I feel for people. I actually did look for some opportunities to try to help in the hospital. I'm not an airway specialist, and I'm not an intensivist. I'm a breast cancer surgeon, so I'm sort of highly specialized to do what I do, which makes me unspecialized to take care of the COVID patient. But I did look for those opportunities. I wasn't really, that concerned with myself, if that makes any sense,
Sure. So let's get into, boil down exactly what you do. If you're in front of a bunch of third graders at a career day, and one of the children looks up at you and says, "What do you do for a living?" how would you answer them?
Well, I'm a surgeon, and I'm a breast cancer surgeon, and that's my primary job. That's what I'm trained to do. I'm not doing that right now, but I'm using my cancer background. For instance, my biotech company, I've discovered a technology where we can evaluate a biopsy in about 10 minutes versus the conventional histopathology, which takes 2 days to 2 weeks. So I'm involved in developing a disruptive technology that should hopefully make medicine better for the world. So, no matter what, I use my healthcare background. And that's included in my children's books. So, these children's books are medically based. They're supposed to teach kids about basic health, and I do it in a very entertaining way. I develop a mystery of what's causing, usually child animals to be sick. And in Doctoroo, the hero, she then whittles down what the different causes could be until we get to the answer. So
yeah, no, that makes total sense. And I'm thinking, with you describing the fact that you're doing some pretty high level things as a medical professional, this has to be a really good, welcome kind of deviation, so to speak, from what you're used to kind of delve into not only a level of prevention with these books, but to get into another world of art and literature that's not what you do on a regular basis.
Yes, it's always been in my heart to be a writer and an artist. I write novels as well. So that's always been a side of me that I just sort of, repressed and put on hold for a very long time while I was training and very, very busy in my medical world. So I've sort of used this time while I sort of reinvented and switched gears into the entrepreneurial world to to also write my books. So this Doctoroo is a series. It's not one book. Currently, I've got 2 books, a coloring book, and we're working on a 3rd book. I have, I could write 1 million of these, but I wanted to kind of get about 4 done at a time, try to market it, sell it, before I then come out with the next group of books. So that's kind of how, because there's so many topics. There's, exercise and dental care and, there's just all sorts of basic health problems that need to be addressed. And I've so far addressed, germs and infection prevention with hand washing, sun protection, and my 3rd book is going to be nutrition.
So you're obviously a very highly driven, motivated human, and you do a lot of great things, So how did this start for you? What was your childhood like to give you these seeds?
My father is a physician. He's an internist, so I guess it's sort of the family business. Not to be morbid, but sadly, my 4 grandparents were Jewish and they were Holocaust survivors, right? So most of my family, unfortunately, succumbed to during the war and did not make it out. So from a very young age, it was instilled in me that I was supposed to do something very profound and positive for the world. And it just became sort of a part of me that I'm here to be a helper, not somebody who's here to take, but to give. So I think that's a big part of what I do. Kind of, the kill 'em with kindness mentality. Like, what happened to my family, instead of taking a bitter approach, to do the opposite, to say like it's, I got to be one of the lucky people whose lineage thrives, and it's sort of up to me to do positive things for human beings and try to advance the society in a positive way. So I would say that would be a major motivator. And then, I was always good with sort of talking to people and helping people, and people came to me when they needed help, whether that was either talking through problems or even physical problems. People used to come to me long before I was a doctor. So, it almost seemed preordained. And, I was a scholastic as well. So from an early age, I loved school. I can't say that I loved school by the time I was like 32, but when I was a child growing up, I really loved school. And, I did pretty well in my pre-meds in college and, made it into med school early. And, from there, I matched in general surgery. So, these were some competitive fields, so I had to work hard. But I was up for the task, I sort of enjoyed the challenge. And I would add to this is going to sound maybe out of left field, but maybe not. I'm a musician. So I play 4 instruments, and I'm a tennis player as well. And I could tell you that surgery requires a certain level of athleticism and a certain, level of hand nimbleness to be able to perform successfully. So I kind of, from my background, playing instruments and athletics, I kind of knew that it was sort of combining all those skills that I had in my hands to be a surgeon. So that's kind of what started me off on that track. But I can tell you that I was a Spanish literature major in college, and I remember, loving writing essays for English and other subjects, and I loved writing. So writing was the way that I expressed myself. I used to keep journals of my patients and things like that. So writing was always a passion of mine, separate from the medical.
So who would you consider? No, go ahead. Can you hear me?
Yeah, so you said who would I consider?
Oh, yeah, I was going to ask who you consider your hero or role model.
Well, I got lucky enough to meet my hero when I was in college. you guys might not the audience may not remember him, but C. Everett Koop was the Surgeon General of the United States, back in the 80s under the Reagan administration. He was very big with, anti-smoking regulations and raising awareness of STDs and HIV. And I don't know if you remember him. He had the Amish-looking.
Oh, yeah.
Yeah. So he had gone to Dartmouth Medical School, and I went to Dartmouth undergraduate, and he loved it up there. So he had opened up an office, and he regularly saw medical students. And I had decided my second year of college to plan a medical region in Nicaragua. And so I met with him, and he and we had like a frank discussion about the problems that were going on in underserved countries and how to help them. And he signed on as my advisor, helped me collect an autoclave machine and tons of medical supplies. And because of him, I was able to undertake a successful mission with a lot of other people jumping on board and funding the trip. And that program, I think it lasted a decade. Other people kept going on that expedition. So, that was one of my passions, was international medicine. It became hard once, I had a practice in this country to include that in my life's work. But that was something in my early work I really loved, which is why Doctoroo is actually a traveling doctor. She goes to different countries where she's called.
So speaking of your books, what's been one of the best fan letters responses you've gotten?
Oh my goodness. You're embarrassing me now. I have to say, I feel so lucky. I have gotten such nice feedback from people. Things like this is an extremely entertaining children's book. Like, we love Doctoroo. We love the characters. They think that the characters are funny and engaging and really teach an important health lesson. So, I have to tell you, it's hard for me to think of who's my favorite, because there's just been so much support, like across the board. I'm sorry if that's not creative enough. I wish I could.
No, that's good. No, that's good.
And I intended this to be a book that really everybody could find something to love about it,
Yeah.
I have to say, it's not a compliment to me, but people have been loving the illustrations. I found an amazing illustrator in the Ukraine. So believe it or not, she's in the middle of a war, but she generates these amazing sketches. And so the illustrator brings my characters to life. So I owe her a lot of credit. People are absolutely singing her praises.
So let's get to the essence of you. Everyone has a perception of you, an idea of you, your family, your friends, your readers, your clients, but you ultimately live your life. What's your perception of you? Who do you think you are?
I think I always put my purpose is to help people. I think that, I listen, I always tell people, like, you don't want me on your soccer team. I will definitely kick the goal into the other side. I'm terrible at it, right? But I am a talented physician, and and I have a way of connecting with people that's a little bit unusual. Even when I was practicing, they utilized me a lot on like Fox News and CNN as a guest expert, because one of my best talents is that I can take a complex situation, a complex medical problem, and I can make it digestible for the general public, through analogies. I always say that's because I'm the lowest common denominator. For me to be able to understand things, I need vivid examples. So I try to find vivid examples for people, and I think that's my best sort of talent, is to be able to express. So I'm an expressionist. I'm a storyteller. Whether that's through my medical practice or through writing, I'm a storyteller. And those stories, though, are not just to entertain. They're to educate. They're to really help move the society forward. Even my entrepreneurial effort here, it's a moonshot. Like, we're trying to go to the moon here with this invention, but it's a story. It's a story, and hopefully it will have its place in history because of what we're trying to do. It's like I said, changing the ability for a patient to not have to wait days and weeks to get a biopsy result is a major shift in the paradigm, and will allow treatment to start occurring much earlier as well, which is again relatively groundbreaking. I would say I don't even take the credit myself. I have such a great team, so. But yeah, that's kind of what I am. I'm a bit of a visionary and a storyteller.
I love it. So if anybody wants to get your books and they want to learn more about you and what you do, where's the best place for them to go?
So I have a website, www.doctoroo.health. Okay. So you can see a little bit more about the Doctoroo series and the books. You can order all 3 books. So you can't order it from the website, but the website will take you directly to Amazon where you can place the orders. The other way to do it is just to go directly to Amazon and, type in Doctoroo and everything will come up.
Wonderful, Rachel. I think we did it. I think we got under the wire. We got it all.
We did.
Thank you.
Thank you so much. That was a wonderful interview. Thank you for having me.
Thanks for tuning in to another famous interview with Joe Dimino, where we cover the world of art, literature, business, spirituality, medicine, and music from around the globe. If you want to hear more interviews, visit the Famous Interviews with Joe Dimino channel on YouTube. Thanks again for listening, and until next time.